most talked about possible etiological factor for capsular contracture nowadays is biofilms. In a paper from St. Louis, the authors look at biofilms on the expander, the implant, the capsule, and even ADM. I would recommend this paper to you, and also suggest you read the very insightful commentary by Dr. Anand Deva from Australia, who has published extensively on the role of biofilms in capsular contraction. Venous thromboembolism is of great concern to us, especially in elective aesthetic surgery. I recommend an article in this month's issue by Dr. Paresi and colleagues from New York looking at whether vaginal contraceptive rings increase the risk of thromboembolism in the aesthetic surgery patient. I would also recommend the very thoughtful commentary by Dr. Panucci, which follows the original article. We all ask our patients whether they're on birth control pills. We ask them for other factors that may contribute and make them higher risk for thromboembolism, but we rarely ask them whether they have vaginal contraceptive rings. We're all searching for the fountain of youth, and right now it seems to be stem cell based. In a paper from Canada, the authors actually look at this and, for want of a better word, actually look at truth in advertising for the stem cell based therapies. And a commentary from Mr. Ashma Sahibi from London puts all of this into perspective and is also a reminder that this issue of stem cell therapy is an international, worldwide concern where exaggerated, unfounded claims are being made. It's very rare that I recommend an editorial to you, but I strongly recommend the editorial by Dr. Steve Dayan, Mind, Mood, and Aesthetics, where he brings to our attention that especially with some of the injectables and of course surgical procedures, we're not only improving the aesthetic appearance of our patients, but we're also having an effect on their well-being and their mood. In his very thoughtful comments, he looks at how our treatments affect our patients' lives. He also points out that at least with the injectables, we are just scratching the surface, and that the growth for these procedures has nowhere near been realized.